Welcome to our Phase 1 trauma course with Relational Healing and Catherine Newton, licensed clinical social worker. Today we're going to be talking about symptoms of complex post-traumatic stress disorder, or what some people call childhood trauma. Really, really important that you understand what the symptoms of complex PTSD are, and it's so important for you to be able to identify the symptoms that you suffer from. So today we're just going to list them and talk a little bit about each one. And as we do this, I want you to go through and write down any that apply to you and any that maybe you're just not sure about. Okay, here we go. So typical symptoms of complex PTSD, black and white thinking. So that is a larger concept, that all or nothing, black or white thinking. It gets in the way of people being able to just be in relationship. It's always or never. You always do that to me, or you never take care of me the way I want to be taken care of. They see things in very black and white terms. And so it's really difficult for them to have any flexibility or adaptability in their relationships and the way they function. So that's number one. And that is pretty typical. It's something that we struggle with because as trauma survivors, a lot of times we're living out of those child parts that are unintegrated. And children think very black and white. Children are very concrete in their thinking. So the minute you kind of catch yourself stuck in that all or nothing thinking, that's a clue that a child part of yours has been activated. So just remember that. That's a little extra bonus. Number two, compulsive behaviors and addictions. So common for people that have had childhood trauma to have compulsive behaviors and or addictions of any kind, because when you're little and you're being abused, you don't have a lot to grab a hold of to cope with. And so you just grab a hold of whatever you can grab a hold of. And a lot of times it's something like food or masturbation. Those are two common ones for childhood trauma survivors. Different OCD tendencies, because you're trying to bind your anxiety as a child living in a scary situation. And so these compulsive behaviors tend to follow us into adulthood, where maybe we have a little bit more options available to us. Actually in adolescence or adulthood, we might be able to get a hold of some alcohol or some drugs of some sort. And then when we start working and making money, then we can shop and we can gamble and we can do all kinds of other compulsive things that really help us push the pain down. So super common. Reenacting your trauma story in your relationships. The nature of trauma is to reenact it. And so what you may, until you really gain some awareness about how you're living your life, you may end up reenacting your trauma story in one relationship after another. The typical example is the female who, grew up with a ragey, alcoholic, abusive father, and who continues to marry one of these kind of guys after another. One might be dressed in a suit. One might be dressed like a blue-collar worker. One might be completely unemployed. But you're just changing seats on the Titanic. This type of relationship gets reenacted over and over. So it's very typical until the trauma survivor starts to gain some awareness about these patterns. Frequent emotional flashbacks, and what's also referred to sometimes as spontaneous age regression. Frequent emotional flashbacks are when you flash back to the past after you've been triggered, but you're not aware that that's what's happening. So somebody might come into your office, someday, and might say to you, listen, I need to talk to you tomorrow, and I want to meet you in my office at 1 o'clock, and it happens to be your supervisor. So then you get really activated, and you're afraid you're going to get fired, even though you're the best employee in the world. You've never been written up, but all of a sudden you're going to get fired. You're absolutely sure. You start to get activated. You start to get little, which is that spontaneous age regression. And by the time you go into your supervisor's office, you're in tears and you're feeling like you're about 3 years old. That's an emotional flashback or spontaneous age regression. That supervisor used a tone of voice with you, which triggered you. So that's just one simple example. This happens all the time with childhood trauma survivors, and it is one of the main areas that if you can develop an understanding and you can learn to manage these emotional flashbacks, you are 50% of the way there. So super important symptom, which we'll get into later. Delayed emotional development. A lot of times you'll see somebody kind of stuck in little, I call it. They're stuck in little. They're not adult at work or on the job and then regress when they get triggered. They're always little. And, you've probably met people like this that, even though they're maybe 50 years old, you really feel like you've spent some time with a younger person. So that's delayed emotional development. Obviously, it affects relationships. Phobias and panic attacks, those are super common, and sometimes these panic attacks seem to come out of nowhere, but really they are activated by some trigger that the person's not aware of. And then there's also free-floating panic attacks that are just, you're having a panic attack because you are so hyper-aroused all the time that it doesn't take much to kick you over the edge. So, super common. Confusion about sexuality, sexual identity, sexual norms, confusing love with sex and or intensity. So those are two different things. Trauma survivors oftentimes, because they have such gaping attachment wounds, they want to put anybody in those wounds. And so sometimes they may think they have a same-sex attraction, but what they really are trying to do is get those attachment needs met that they never got met in childhood. And this person just happens to be treating them nicely. And so they develop an attachment to that person, and then all of a sudden they think they have a same-sex attraction. So that happens a lot with childhood trauma survivors. And also the confusing sex with intensity or love with intensity. That, if there's not always a chaotic situation in my relationship, then the person doesn't love me. Or because there's so much intensity, they love me. And that is not at all the case. Avoiding sex because of the fear and discomfort. Maybe the person was sexually abused, or maybe their parent was emotionally incestuous. It doesn't have to be physical incest that causes that discomfort. A felt sense of being different or defective. This is number one on my negative cognitions list, my negative belief list that trauma survivors check off, is that I'm different, I don't belong, there's something wrong with me, and overall, I just feel like I'm defective. Okay. Difficulty trusting. Obviously, this is a huge one. If the people that were supposed to keep you safe in life didn't, then you're not going to trust anyone, and you're going to struggle with this as you move through your recovery. So difficulty trusting, dysregulation. Dysregulation is defined as the poor ability to manage emotional responses or to keep them within an acceptable range of typical emotional reactions. This can refer to a wide range of emotions, including sadness, anger, irritability, and frustration. So, we talked about this earlier, with frequent emotional flashbacks. A person who's having frequent emotional flashbacks is going to be dysregulated all the time. A person who is hyper aroused and always looking over their shoulder and waiting for the other shoe to drop is always going to be dysregulated. And that's a term that goes with the nervous system. Your nervous system is dysregulated. So you're always prepared to be injured. You're always, waiting for the next bad thing to happen. And so when you walk through life as an adult now and you are constantly dysregulated, your perceptions of reality are going to be skewed. And so decreasing dysregulation is a phase 1 concept. It's a phase 1 task, and it's a daily task. It's something that trauma survivors have to do daily. And eventually you get to the point where you're able to decrease your dysregulation permanently as you go through healing. But initially, it takes a lot of work and a lot of commitment to decreasing that dysregulation. And some trauma survivors do take medication. I have found that the SSRIs, the selective serotonin reuptake inhibitors, do tend to pull down that hyperarousal just a little bit so that it's not quite so high. So there's going to be less of a tendency to get activated quickly, less of a tendency to have a panic attack, things like that. And so that might be something you want to talk to your primary care doctor about or not. So dysregulation, extremely poor sense of boundaries. When you begin healing from complex PTSD, your boundary work is going to be a huge area for you because no one kept you safe. No one kept you safe when you were growing up, so you have no skills to be able to keep yourself safe. So your boundaries tend to either be too rigid, where you don't let anyone in, or too loose, where you tend to let anyone in. And obviously, one leads to further re-victimization, and the other leads to isolation and loneliness. And so, all or nothing again. Okay. Lifelong search for nurturing and belonging. This is a huge one. People are not aware that they're doing that. So many trauma survivors are really looking for a parent, not a partner, and they don't know it. It's really important to understand that I use the concept of sticky tape, that we all have sticky tape when we're born, and our parents are supposed to addict to that. We're supposed to put our parents there. But when there is no parent, and they're not doing a very good job, we have open sticky tape, and we just try to put whoever we can in there so that we can get those needs met. And because it's a younger part of us that's so desperate, that part has no discernment, and so the things that part puts there usually aren't so hot, which leads to destructive relationship patterns. When little kid parts are running the show and they're the ones choosing the partner, they don't do such a great job. Compulsive secrecy, feeling like that criminal in hiding. If people just knew who I was really deep down inside, they would despise me. Those kinds of things lead to compulsive secrecy, and because there's typically compulsive behaviors, that leads to compulsive secrecy because of the fear of shame. And shame and fear-based thinking, again, so much of what drives trauma effects are fear. That hyper-aroused nervous system, that chronic, you chronically grow up in that. There's this steady diet of fear-based parenting and shame-based parenting, and then sometimes when you grow up in a spiritually abusive home, you end up confusing God with your abusive parent, and so then your spirituality gets skewed on top of everything else. Self-hatred, self-harm, again, you see a lot of that. Self-hatred because you've internalized the perpetrator. You had to. There'll be a video on the internalized perpetrator part. When you grow up with someone who's abusive and verbally shaming and verbally hateful, you tend to internalize that in a strange kind of distorted way to stay safe. Because if you can shame yourself, it feels a little better than being shamed by someone else. Again, all of this is outside of our conscious awareness most of the time. The last one is poor self-care. Most of these concepts are pretty global. We will run into some specific symptoms later on, but poor self-care is a big one for trauma survivors who tend to either overwork, don't take care of themselves, don't even notice if they're sick, don't notice if there's a part of their body that's hurting, don't tend to go to the doctors, don't tend to do any preventive care because they live in survival mode and it's a war zone. And when you are at war 24/7, Who has time to go to the doctors? So again, I hope you were able to understand these symptoms and check off the ones that you think apply to you, and then we can delve into these, a little deeper later in the course, so that you can start to heal. And we're so excited about that. That's the most important part, is that we want to get to the point where we can recognize these things, start to increase our awareness of what's really going on in our inner life, so we can set healthy boundaries that facilitate grieving and healing. So that's it for now, guys. Thanks for tuning in, and I will talk to you again soon in this Phase 1 trauma course with relational healing. Thanks, and God bless.